All right, team. So today we're talking about a little weight loss program. It's so funny because we were just talking before this. We're almost the exact same height and weight, and I'm just 3 weeks ahead of you. But you're going to join the journey with us. So this is awesome. There's a couple different options that we're going to do. We've been talking a little bit about this. The idea is that this isn't replacing, diet and exercise. It's just improving this. And the really cool thing about some of these new medications is it just really decreases your overall appetite, makes you feel a little full, a little bit faster. That way we can decrease our calorie intake and then get to a good spot slowly and safely over time. One of the things we talked about previously was that, plastic surgery is super cool, but lipo, tummy tuck, those things are not weight loss procedures. The better job we can do getting you to your ideal weight ahead of time, the better you're going to do afterwards. So do a little Q&A in just a second and we'll talk about this. All right, team, so we're going to do a little question. Figure we do it with you guys, as you guys may have some of the same questions. Any questions you all have?
So what's the most common side effect?
Yeah, I think the most common thing people feel is nausea. And so, no question, when you just start it, you definitely want to eat slowly, eat little by little, because that, no question, can trigger it. I think after you change your dose, people can see a little bit of the nausea. I've been fortunate, I haven't had very much of that. Some other people in our office have had a little bit of nausea, but definitely controlling your portions, staying away from some of the carbonated drinks and stuff help with that as well.
What type of dose variations are we looking at over the span of the?
Yeah, that's a great question, because we definitely have to start at a small dose, titrate it up. And this is the nice thing is we have people come in every month, so we can do a weight check, we can titrate your dose, get you to a great spot, and that way it balances that you don't feel too many of the side effects, but also get you to a good spot where you're hitting your ideal weight. We can also kind of help coach you along the way if we need to do some diet or exercise tweaks. And this is where it can be frustrating. Like both of you, I know, work out a lot, but it's just like you can work out a lot, but if you don't do some of the diet things as well, you don't really get to the results you want, and all those muscles are hitting up.
Yeah. So what's a good patient?
Yeah, I think this is great. So someone who's in good overall health, because there are a few medications that we can't combine this with. There are a few things that people have had issues with their pancreas, GI system. We got to work through that and make sure that this is actually a good treatment for you. Interestingly, if somebody's had thyroid cancer, that's not a good patient. That's different from just having hypothyroidism. If you're on Sonterra, those type of things, you can still do this. If you're diabetic, this is something that we definitely wouldn't do without talking to your primary care or your endocrinologist. So that's why we always see everybody, do a full consultation, review your medical history, make sure we're in a good spot, and also make sure that there's not other things in your life going on that are causing this weight gain, because sometimes there can be some other issues going on and want to make sure we're not missing anything.
What does this come in, like a pill or?
Yeah, I wish it came in a pill. That'd be a little bit easier. We actually do an injection that just goes into our sub-Q, our fatty area. Typically, most of us who are starting this have a little bit of fatty areas that we can inject to. I do it myself, and so I do, one side of the tummy, one side of the tummy, my leg stuff. It's just a once a week. I set my day and just do it. It has some pretty filled syringes, so it's super easy, super smooth.
Same time every week?
It doesn't have to be the exact same time, but same day. And if you're behind a day, just as soon as you realize you missed a day, just get back on it. So. All right, team, this is cool. So one of the questions that we had is how long do you have to be on this? It's going to vary from person to person. A couple things. One is the way it works is you've got to titrate the medication up to a good dose. And so, most of the time at about 20 weeks, we get to a good steady state. Some people a little sooner, some people a little longer. Just depends on how you tolerate that. The idea is that we keep people on this for a good amount of time so that you create new habits, that stomach shrinks, and then we can look at slowly weaning people off depending on their lifestyle, those types of things. One of the really cool things, even in the studies where they took people off or switched them to a placebo, in general, these medications, people lost about 15% of their body weight. People who came off it only rebounded and gained 5%, which typically probably meant they made some lifestyle changes, just changed some habits. And most of us just need a little jump start to change a few little habits that we know aren't great, but we just need to tweak.
Okay guys, so we are going to do the semaglutide injection today. We're going to do it into the subcutaneous fat, so it's going to be along the abdomen. One of the really great tips that we tell patients is that if you go along the line of where your pants would normally hit your abdomen, that skin is already desensitized, so it's a great spot to do these injections where you won't really feel it. So go ahead and lift your shirt for me. So first we go ahead and cleanse the area with some alcohol. I want to make sure it's nice and clean. And it's super simple. These are insulin syringes, so really tiny needle. Just slight pinch to the area, inject, and that's it. No bleeding, all good to go.
Painless.